Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm ASHLEIGH MESSERVY. It's Medical Monday here at East Cooper Medical Center, and today we're sitting down with two Lowcountry plastic surgeons to discuss the process for using a patient's tissue during breast reconstruction surgery.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, Dr. CRAIGIE and Dr. KLINE. Thank you both so much for having me today. Okay, so today we're talking about breast reconstruction using your own tissue. First of all, let's just start. What does that even mean? When would you need breast reconstruction surgery?
Well, a woman who goes through mastectomy, which is removal of the breast, usually in the treatment of cancer,
okay,
would desire to have her body back together. And breast reconstruction restores the breast at that time or later.
So is it a really positive thing when you're using their own tissue? Are you always using their own tissue, or is this a kind of a new thing?
Well, we kind of came on the map, if you will, because we have special expertise in using women's tissue.
Okay.
Actually, 80-some% of women who are reconstructed using implants, and we offer that also.
Okay.
But our particular area of expertise is reconstructing breasts using only a woman's own tissue that God gave her.
Okay, and so where are you getting this tissue from? Or is it coming from other areas of the body, or how does that work?
We look at each patient and decide if they have extra fatty tissue that we can use without taking their muscles. And so if they would like a tummy tuck and they have enough tissue, we can give them a tummy tuck and use that extra fatty tissue and the skin to rebuild a new breast in a natural way.
So if you're talking to people, you know, a lot of times plastic surgery and stuff, you know, gets a bad rap, but how would you explain to the client that are you really just trying to get them back to what they were feeling before?
Right. When you say plastic surgery gets a bad rap, I think people confuse plastic surgery, cosmetic surgery, and reconstructive surgery.
Yeah.
Plastic surgery is anything done by a plastic surgeon.
Okay.
Cosmetic surgery is taking one variation of normal and changing it to another variation of normal, which some people may think looks nicer.
Okay.
Reconstructive surgery is taking something that's distinctly abnormal, i.e. a woman who has lost her breast due to cancer or due to a precancerous condition which has caused her to have her breast removed, and trying to restore for her a sense of normalcy by reconstructing new breasts as close to the originals as we possibly can.
So talk about some of your patients. I'm glad you clarified that, because, you know, when you said implants and things like that, you know, I think that's typically associated with plastic surgery, but talk about some of the ways that this really, I mean, after something so traumatic is having to go through that, how you are able to give them really a sense of self. They kind of come back to life, essentially, right?
Sure, and it's a functional thing, so it's not in the category of cosmetic. We're restoring their body to the way it was, and certainly if there are things that they might want to change in the process as plastic surgeons, that's one of the things we consider.
Okay.
In the end, we want the patient to have the best possible result. Each person may elect for a different way to do the reconstruction, but using your own tissue gives a more natural, permanent result that is made of the patient's own fatty tissue.
Okay.
And so once the process is done, then it's a more permanent, natural result that doesn't have to be redone in the future. And it tends to change with the patient.
So is there any special preparation that patients would have to do in order to go through this process?
Usually not. Occasionally, if patients are very significantly overweight, we will ask them to lose weight first because it makes it a little bit safer.
Okay.
Some of the operations for reconstruction with your own tissue are a little more involved than reconstruction using implants. I'd also like to add that Dr. CRAIGIE mentioned the most common area to take tissue is the stomach.
Okay.
But we also have done several hundred reconstructions using the buttocks, which is offered in very, very few places. Fortunately, we were trained by the gentleman, Robert Allen, who invented both of those procedures. So we're able to offer both of them with a really high success rate.
Hey, kind of piggyback off of that, what makes you different from all the others, aside from the different types of training and how you take it a step further? What are some of the other ways that when people come here, what will they see?
Well, one of the main differences is that we're able to take just the fat and the tiny blood vessels that nourish that amount of fat. And so what that allows us is to preserve important muscles. You can use your own tissue, and other techniques may provide natural tissue, but it's at the expense of an important muscle. And so because we use a special type of microsurgery, we can actually separate that tissue from the body but preserve the muscle itself, so that later a patient won't have problems because they had to give up an important muscle in their body. And so we can take those tiny blood vessels, an artery and a vein, and the fat that it will nourish, separate it from the body, and then reconnect those blood vessels to blood vessels that are normally sending the blood supply to the breast. So those are very tiny blood vessels, 1 to 2 millimeters sometimes. And so that part has to be very successful, and that's what Dr. KLINE and I do. Our background is in doing that type of surgery where we can use just natural tissue but preserve muscles and do what's called microsurgery.
Well, thank you both so much for all this information. I
Our
definitely
pleasure.
feel much
Thank you
more
for
educated
coming.
on it. So thank you both.
Thank you.
And of course, for more information, you can always go to eastcoopermedctr.com.